Today it's a cast bar insertion. So once we go with the impression, once the patient in the mouth, the lab fellow will make ready this cast bar. This is the upper one. He made it into two pieces so that insertion removal becomes easy. So this is in the first quadrant. So main thing is the path of insertion is very important. So if you can remember the path of insertion, you can place it well here also and also in the patient's mouth. So in the first quadrant we are going to place, we'll insert from the front like this, can you see? And then go back and will be undercut will be there, so it's placed properly. Okay, the same way in the second quadrant also. This is the second quadrant wherein you have 1, 2, 3, 4, 5 implants are there. There are 10 implants in the upper arch. Patient was using denture before almost for 10 to 12 years I think. So in the second arch we'll start inserting from the back implant, that the last one that is in the molar. Okay, insert it here and place it here, and then can you see? So and then you have to push it in. Yeah, now it's fitted. So this is the upper one. So this cast bar, there will be undercuts in the patient mouth also. We have to trim those. I've marked the undercuts where there is it's not easy to insert, so we need to trim that surface in the patient mouth, then only it will sit properly. It sits properly in the ridge. So this is the thing, this is the upper one. In the same way, lower also, we made it into two pieces. Can you see? This is the lower one. So this is the two pieces. That is the third quadrant. Third quadrant, here the path of insertion is there is place it on the back implant first, then you place it here. Okay, then you push it in, it's seated now properly. So in the fourth quadrant, in the same way, the path of insertion, if you can remember the path of insertion, it will become easy for you to place it in the patient mouth also. So here same thing, we'll start from the last implant. So I just removed it, I'm going to place it now, place it here, place it on the back implant. So what you're supposed to do is, it has to go, there is undercut is there, and then you push it, not seated. I marked the undercuts where it's kind of hindrance is there, where you can where this cast bar will not go. So those marked areas should be trimmed, then to place it in the patient mouth. We are using this time in this full mouth rehabilitation case a different method of fabricating the prosthesis. So what we are doing here is explained about the path of insertion, how we are going to insert the metal bar in the patient mouth. This cast bar here in this case, so this is the new method what we are using. Once everything is fine, if the cast bar is fitted properly in the patient mouth, so we have to check for the occlusion, and then we are going to fix this metal cast bar permanently in the patient mouth with the luting cement, both this one lower as well as upper. We are going to fix this permanently in the patient mouth. So upon this cast bar which is fixed in the patient mouth, we are going to take the putty impression. So once the putty impression taken, you can take in the single stage with the light body, or otherwise you take the putty first, then apply the light body and take the secondary impression again. You can do it that way also. So we are going to take the impression after fixing the cast bar in the patient mouth. So whatever the impression you get upon this the lab technician is going to prepare the crown, that is the trial crowns. So for this patient we are not giving hybrid denture, we are giving the PFM crowns all over, both in the upper and lower. So he will give the trial insertion with the PFM for this case. So once we are going to fit those trial on this cast bar and look for the occlusion as all those things, then we are going to decide about the shade for the patient and the size of the tooth, the shade which suits for the patient. So after that, once in the trial everything is fine, occlusion, shade, size, all those things. Especially posterior occlusion is very important. That's for the patient's chewing, and also anterior for aesthetics. So once everything is fine, we'll ask the patient, show the patient how the final outcome will be, and again we'll send it to the lab. So they're going to fabricate the final thing. So that will be the final processes will be fixed, same with the luting cement permanently in the patient mount. So this is how the prosthetic process from the cast part till the final insertion of the fabricated PFM crowns. Thank you.